Would like to begin with the health crisis in the country. And doctors working in government hospitals began their nationwide strike today over inadequate insurance benefits and lack of protective equipment while treating COVID-19 patients, among other grievances. This coming just 2 weeks after the nurses and clinical officers began their strike. And as Raquel Mugai reports, Kenyans have just began feeling the pinch of the already crumbling public health system.
36 days since the Kenya Medical Practitioners, Pharmacists and Dentists Union KMPDU issued their strike notice, and several meetings later between the union and government officials.
Solidarity forever.
And it is clear that an industrial action is the way to go for the doctors. Their strike commencing on Monday.
No amount of intimidation, no amount of threats will make doctors go back to work.
Doctors' welfare is not a PR show. It is not a matter to gallivant about and to pussyfoot about.
Yes.
The minister should be very clear on how he wants to handle doctors' affairs.
Kenyans being on the receiving end as a result of the creaking public health system. Families forced to transfer their loved ones admitted in various hospitals like Baringo County Referral Hospital to other facilities.
Tangu jana mpaka saa hii hajapata usaidizi yoyote. Na mkuu amevunjika. Sasa mkuu akivunjika, akipita saa ya kusaidiza utapata kweli lini na kuharibika tu.
In Nakuru, it was no different. For the lucky ones who managed to be attended to, the services were slower than usual.
Nimetibiwa na nikapigwa picha na hata madawa nimepata. Kwa hivyo naomba serikali ijaribu kutimisha ile ahadi, ndio wale wa daktari hawajaingia, ndio hata wao waingie.
And as various facilities remained like the Moi County Referral Hospital in Voi completely shut down, here in Nairobi, there was a low turnout across major public health facilities.
Mimi nimekaa hapo nimeambiwa nigoje kidogo. Nikiona sasa ikienda narudi tu kwa nyumba. Hakuna venye nafanya.
The doctors have just begun their strike 2 weeks after the nurses and clinical officers laid down their tools.
It's even better for you to be sacked and look for the job next year.
We are ready to go and be with our families than go to our graves.
The health workers demand for an enhanced risk allowance, provision of a comprehensive medical cover to all healthcare workers, employment of healthcare workers across all cadres, provision of adequate personal protective equipment, and a constitutional health service commission that will put an end to the health issues in the country.
If they have decided to go on strike, also let us also take stern action against them.
They should not down their tools. That should be completely the last resort. I've urged the government to behave more responsibly.
With the Health Cabinet Secretary threatening to fire all healthcare workers who engage in the strike, the unions insist that too will not force them to resume work until all their issues have been resolved. Raquel Mugai, Citizen TV.